In almost every medicine cabinet, there's this little pill. It's one of the most powerful, common tools we have for pain and fever. But are you sure you're using it correctly? Let's get into the user's guide for ibuprofen.
Okay, picture this, that splitting headache that just won't quit. Or maybe it's a nagging backache, or you've got a sudden fever and your muscles just ache. These are the exact moments we all reach for something, anything, to give us some relief. And for so many of us, that something is ibuprofen.
So what is this stuff really?
Well, ibuprofen is part of a group of drugs called NSAIDs. That's short for non-steroidal anti-inflammatory drugs. And its power is kind of like a triple threat. It tackles pain, it brings down a fever, and, this is the big one, it fights inflammation. That's why it works on so many different things. But just because it's so versatile, that doesn't mean it's a magic bullet. To use it right, and more importantly, to use it safely, you've got to understand what it's for and what it's definitely not for. There's one huge limitation we need to talk about.
And here it is, the most important thing to get your head around. Ibuprofen is a rock star at managing symptoms. The pain, the fever, the swelling, it knocks them down. But what it doesn't do is fix the root cause. So if your pain or fever is sticking around for more than a few days, that's your body's way of telling you, hey, go see a doctor and find out what's really going on.
All right, let's get down to brass tacks, the rules of dosage. And believe me, getting this right isn't just about making the pain go away. It's about being safe. And pay close attention here because the rules are totally different for adults and kids.
So for adults, it's pretty straightforward, right? The dose is just a standard amount in milligrams. But for children, oh, it is not that simple. You absolutely cannot guess. The dose has to be calculated very carefully based on their body weight. This is super important for it to be both safe and effective. So for an adult, what's the magic number? Well, the most you should take over the counter in a full 24-hour day is 1,200 milligrams. And that usually looks like taking 1 or 2 200 mg tablets, so, 200 to 400 milligrams, every 6 to 8 hours when you need it. And for a child, the absolute maximum for a day is 40 milligrams for every single kilogram of their body weight. See why you can't just guess? This is exactly why you have to read the box so carefully, or, even better, just ask your pharmacist to make sure you're giving the right weight-based amount. Okay, look, any tool this powerful comes with some serious responsibility. And while ibuprofen is generally safe if you use it right, it is absolutely not for everyone. So now we've got to talk about the really critical stuff, the warnings and contraindications. So before you even pop open that bottle, you have to ask yourself a very simple question. Is ibuprofen actually safe for me? Because for a surprising number of people, the answer is a hard no, or at the very least, not without talking to my doctor first. So let's run through a quick mental checklist. If you've ever had stomach ulcers or bleeding, if you have certain heart or kidney problems or untreated high blood pressure, you need to avoid it. Same goes if you're in your 3rd trimester of pregnancy or if you're on certain blood thinners like warfarin. So you might be wondering, why all these warnings? Well, it all comes down to how ibuprofen actually works. See, it blocks these things called COX enzymes to stop pain and inflammation. But the problem is, those exact same enzymes also do good things, like protecting your stomach lining and keeping blood flowing to your kidneys. So if you use it a lot or in high doses, that protection can get worn down. All right, let's wrap this up by boiling it all down to a few key tips. Think of this as the super quick, need-to-know advice you'd get straight from your pharmacist. First up, and this one's a biggie, always, always take it with food. It is the absolute easiest thing you can do to help protect your stomach. And this should go without saying, but never go over the recommended dose. Seriously, taking more is not going to make you feel better faster, but it will absolutely crank up the risk. More is not better here, it's just dangerous. Now, for anyone in those at-risk groups we talked about, especially if you've got high blood pressure or kidney issues, paracetamol, which you might know as acetaminophen, is often a much safer bet. But as always, your best move is to ask your doctor what's right for you. And one last super critical reminder about pregnancy. You have to be so careful. It's absolutely essential to avoid ibuprofen completely in those final 3 months because it can be harmful to the baby. Look, at the end of the day, ibuprofen is an amazing tool for tackling pain and fever, no doubt about it. But just like any powerful tool, you've got to respect it. That means reading the label, following the directions, and using it the right way. Because the goal isn't just to feel better, it's to feel better safely.